Good afternoon, everyone, and thank you all so much for joining us today. We are thrilled to have you here to learn more about our brand new Nursing Fundamentals line. We're going to give it a few minutes so everyone can get into the webinar before we kick off. But as we are getting ready, we are going to start with a poll for you all just to see who's joining us in the room today. So take a second to answer that, and we'll get the webinar going in a couple of minutes. Amazing. And thank you all again so much for joining us today. We are thrilled to have you joining us. My name is Kate Jancy, and I'm the Chief Academic Officer here at Science Interactive. I've spent the last 10 years working with our team of scientists, instructional designers, and graphic designers to build and develop all of the hands-on and virtual labs that Science Interactive offers across the basic sciences and now in the allied health space. I am absolutely thrilled today to also be joined by Susan Rouse, PhD, RN, and CNE. Susan worked with us in the development of our nursing curriculum, and I wanted to share a little bit about her before we kick the webinar off today. Susan has over 35 years of experience in nursing and higher education at the undergraduate and graduate levels. Her expertise is in academic leadership, curriculum, and faculty development, program evaluation, nursing accreditation, and authoring for nursing textbooks. She also has experience as a bedside nurse in critical care for both neonates and adults. So thank you so much, Susan, for joining us today and for collaborating with us on the development of the nursing content. We're thrilled to have you joining us.
Thank you, Caitlin.
Okay. So before I hand things over to Susan, really wanted to start off today by talking about some of the broader challenges in nursing education today. And I think many of you know this, or all of you know this, is that there is a need for nurses really more than ever. That we are facing impending shortages in the nursing workforce. And so there really is a true need to continue to develop and train more nurses. Looking at some of the statistics out there, approximately 20% of nurses are projected to leave the workforce by 2027, compounding losses during the COVID pandemic due to stress, burnout, as well as retirement. And currently there is an anticipated shortage of about 100,000 nurses today, and that is projected to grow and accelerate through 2030 to approximately 200,000 nurses being in shortage. But there are ways to address this challenge. And really what we see as a huge opportunity is that we can meet the demand for accelerating and growing nursing education through the development of quality nursing programs, both online and on campus. Really fascinating to see the number of nursing programs online is growing and continue to grow. Grew almost 15% from 2015 to 2019. And that growth in the online programs in nursing also corresponds with an interest in students' desire to be taking courses online. In a recent study by EDUCAUSE, 65% of students prefer at least a partially online program as part of their career or training trajectory. And among those students, 60% said if their desired program wasn't available online at their school, they would go to another school to find it for them. So there really is a growing interest in offering online education. But there are challenges with moving courses online, particularly in the sciences and the allied health space, where having a hands-on component is really and truly so important for the student. When we look at bringing lab courses, allied health courses online, we know there's a couple of key challenges our instructors face. First, maintaining the quality of that course. In the 2024 annual lab report that we've developed at Science Interactive, 80% of STEM leaders said that recreating a hands-on experience online is a top challenge in transitioning their course to an online delivery modality. But using a hands-on kit, 75% of instructors found that they are able to recreate a comparable experience to an in-person lab or course. The second challenge that's encountered is affordability. Nearly 80% of STEM leaders are concerned about affordability, particularly when you bring in kits for students, making sure that students aren't priced out of that online course. When we look at the solutions, nearly 71% of students said that the cost of a hands-on lab kit was aligned with the value of being able to do them from home and the benefits that they have not having to arrange for childcare, elder care, take time off from work to be in an on-campus environment. That helps to balance that out. Finally, we know that resources are limited for instructors today. 50% of instructors cited challenges in terms of time and resources in building their lab courses. On the flip side, 77% of instructors using a hands-on lab kit said they were easy to incorporate into their course to support having that hands-on lab experience. Now, when it comes to bringing courses online that traditionally have a hands-on component, there are a number of ways you can approach that. You can approach that with recreating a hands-on lab experience with a kit. You can approach that with using a virtual simulation, similar a simulation of that lab. But when we polled our faculty, our students, our deans and department chairs, one recurring refrain was that hands-on component of these courses are absolutely essential, despite the availability of virtual options. 84% of deans and department chairs rated hands-on labs the most effective format for online students to learn. 90% of instructors said that students using hands-on labs gained the knowledge and skills they needed to continue to pursue their degree path. And that 90% number holds up whether you're looking at non-major students who are just taking one lab course as part of their overall learning experience for their degree, as well as for major students who are taking the skills they learned in that online lab course and using them in further science courses down the line. They were gaining those skills they needed to come into a lab later and higher level courses and effectively use those skills. Finally, for our students, 85% of students said that hands-on labs made their online course more engaging for them. But that's not to say that virtual and simulations don't have a place in the broader education space for online labs. Now, on their own, they're not quite as effective. Of instructors using virtual simulations only in their lab course, 60% said that students would have learned more had they had the opportunity to perform a hands-on lab. However, where we find a place for those simulations is really in one, helping the engagement of students in the course, and also helping students prepare for doing hands-on labs or hands-on experiences. So nearly 91% of students using virtual simulations said that they did help to make their online lab course more engaging for them. And a similar number of both online and on-campus students found that virtual labs and virtual pre-labs have a place in helping them prepare to go into the laboratory course. Doing that pre-lab or that simulation beforehand gives them a little bit more guidance, a little bit more know-how in how to approach the hands-on lab once they're entering their class or opening up their kit for the first time. And so when we take that together and looking at our students that we surveyed, the preferred online science lab course really is a mix of that hands-on and virtual component. It's going to incorporate hands-on labs to provide an authentic experience, authentic ability to work with chemicals, with dissection specimens. In our case for nursing, having the opportunity to perform full body blood draws and similar techniques. It also equips the students with real world experiences, with rigor and support for transferability down the line. But the virtual labs can help come in when we can't provide a hands-on experience. I always like to throw out nuclear chemistry. You can't send those with that equipment home to your students, but certainly it gives them an opportunity in a virtual environment to explore those concepts. It's also a lower stake environment that allows them to practice and supplement their learning styles as well. Now, before I hand things over to Susan to really take a deeper dive into the nursing curriculum today, I just want to take a brief moment to introduce Science Interactive. Science Interactive has been supporting students in their science laboratory courses for over 30 years. For those of you who may be familiar with us, you probably know us best in support of online laboratory courses, where we build hands-on kits and corresponding digital curriculum, virtual simulations to support students in the basic sciences and allied health fields in having a hands-on opportunity despite not being on campus in their lab courses. However, we also have broadened our support over the years, supporting hybrid courses, as well as supporting on-campus courses in terms of making sure that they have enough lab space and simplifying the delivery of labs through our kits as well. We support 15 different disciplines, with nursing being our newest, and over 480 with over 480 experiments, both hands-on and virtual. And every single discipline that we offer is Quality Matter certified. We're very proud of this. Nursing is not our first foray into the allied health space. For over 10 years, we've been supporting pharmacy technician programs as well. But we are so thrilled to be adding in nursing this year through the hard work of Susan and our science team. So, Susan, I'm excited to hand things over to you to share a little bit more about the nursing curriculum and take it away.
All right, thank you so much, Caitlin. If you could go to the next slide. There you go. Great, thanks. So yes, I helped create and I just did more content and then SI did all the technological stuff about nursing fundamentals. And so we really just thought about how we could make this as accessible as possible for those working students or those students that are not able to be at the, bedside maybe. As Caitlin was just talking, I was having PTSD flashbacks about COVID. Remember when all of us were scrambling at that point to try and find ways to do non-traditional clinical settings because we really couldn't get into the hospitals even at the very beginning. So this just really supplements that sort of whole package and giving help to that student to help build that foundational knowledge and clinical skills. And it helps increase enrollment and stand out from competitors. So we know that students nowadays really do like that online learning for the most part. They also like the e-learning, then the hands-on learning at the same time. And we know we're seeing some research come out now that says that e-learning can help students retain between 25 and 60% more information, especially if it's a supplemental along with that hands-on learning. Um, we have with e-learning, the other great thing is, and I'll just date myself for a minute. Back in the day, students would ask, can I tape record your lectures so I can go back and listen to them later? Well, now that's what we're giving these students with hands-on learning in a different way. They're able to go back and watch the video again. And so that's really important to many students. And we know that when they're trying to learn, the more that they see and hear and understand and try to comprehend the content, the better they're going to do with it. And we know online learning uses, unless we're doing AI, less energy and has fewer CO2 emissions. If we're using more AI, which you wouldn't have to use with this product, then we are looking at less energy. And the best thing that we say is that that online degree is about 30K cheaper than a traditional on-campus degree. That would be completely online, and we can see that this product would work with those complete online programs and also with those hybrid programs. And so the other piece that we really want to talk about is the high academic standards to meet those accreditation requirements. And so I've worked very hard to try and make sure that the content with SI is able to help assess student outcomes to be part of that process of continuous program improvement, because we know that that's what the accreditors are looking for on a long-term basis, is to make sure that anything that you add as a supplement or as part of the program really helps sort of meet those continuous program improvements. And then make sure that they're workforce ready. And so students do appreciate having some time to work with that virtual client, whatever it may be, before they actually get in there and do the hands-on. And so having these labs available to allow them to do that is going to help, boost their confidence, make them feel better, and learn better clinical skills. Okay, if you want to do the next slide, there we go. So we've got these clinical confidence with the nursing fundamentals that has these comprehensive kits that have professional grade equipment, including practice arm modules if we're looking to do blood draws, stethoscopes. SI was really good about helping me determine what sort of that list of equipment was needed and then how were they going to best use that, with also thinking about having the student in mind, that, we don't want them to go out and have to buy a lot of stuff that's going to be really expensive and then they're going to use once and get rid of. So, yes, we really thought about that. We have those hands-on practice virtual labs with unlimited repetition and skill reinforcement. And we all know that we have students who, see it once, do it once, teach it once. And we have students who need to repeat the skills several times in order to feel confident. And that in the virtual lab setting, they'll be able to do that easily. It is developed by those subject matter experts to align with the accreditation and the certification requirements. And I know Caitlin talked about it, and I feel like she didn't give it enough credit. But having the fact that this all is QM positive or been aligned with QM is really, really important, especially with the accreditation standards and just in, telling the students that this is a quality product because we know QM is sort of the, the lost my words, but like the line for where we look at online programs to make sure that they are worthy versus unworthy or just not put together really well. It maintains a standard, it grounds in best practice, and it ensures quality for the learners. And then the last really good thing that I really appreciated too was the fact that this content was grounded in um, OpenStax, which is free textbooks. And so if you're not asking students to buy lab equipment, you are also not asking them to buy textbooks, which is really important to them because we all know how expensive nursing school is just on its own. So I really made sure when I was developing the content that I had the OpenStax textbook open where I looked at all of that content in order and just used it straightforward into the development of the labs. Okay. So here are the 22 essential and digital labs that were created. They are hands-on, and then we have some ones that are virtual, like assessing pain, medical terminology, nursing process, medication administration, recording patient history, automated medication dispensing. So again, we're looking for the student sometimes to find a person that they live with or someone that, or their friend that they can practice on. That's something we all have to do in nursing school is have a volunteer that is interested in helping us advance our knowledge. But then we also have those virtual labs where they're going to be working in the virtual setting and doing some things with simulation to better understand how to do those processes, whatever they may be. And with these nursing fundamental labs, the thing that I really also tried to focus on when developing was that there were images and videos and questions that were both evaluation and recall and critical thinking that the students had to record on a data table, that it was content that appealed to all the learners. So we had, students who are not just visual or auditory reading, writing, or kinesthetic learners, but everyone has a piece in these labs that they can say, oh, this is how I learned best. And look, there's content here for me. So I may be able to just breeze through the rest of the stuff, but the stuff that I learned best on is right there for me to do. So that's really also important for our students. All right, so this is kind of how these labs are set up. We have an estimation of completion time. The exploration is just sort of the reading part, the content that I present is presented. Then they have the experimentation. So if they're doing blood draws, reading about it is only going to be about 30 minutes. They're going to have 2 hours of experimentation, and then they're going to have questions to go back and really think about what they learned as part of that evaluation. Each one of the labs has learning objectives that really hones in on what the content is that they're going to learn and what you as the educator are going to know that the students are going to ask questions about or that they're going to talk about afterwards or that you're going to have to be prepared to help them understand. And then, as we said before, and I'm going to have Caitlin also jump in on this, the virtual simulations reinforce that critical skills and knowledge by allowing them to have that simulation piece so that they, obviously it's not cost effective to go get a drug cart for them to pull drugs out of, but here you're looking at one. And so then that student can go into there and virtually pull and figure out how it is that when they actually are doing the hands-on learning in the clinical setting, they'll have some experience of what it's about.
Yeah, absolutely. And so one of the things that we really look at when we're developing our lab list is which labs can we effectively send to our students at home and have the opportunity to really engage with that hands-on equipment. That's always going to be our ideal approach. But to Susan's point, when we're looking at labs that are involve equipment that we can't send to a student at home. That's going to be too expensive, too large. That's a really great opportunity to give students a feel or an experience with a virtual lab so that they can learn those basics and learn those skills. The other case where we really hone in on some of the virtual pieces are going to be when something is too dangerous to be sent home. Or unsafe to have in a home environment, as well as some of the very basic topics that can set up things for students in a foundational nature, for example, medical terminology. And that's where we'll really bring in some of the virtual pieces as well. So we're going to pause briefly for some questions, but what I am going to do is we'll give you a brief tour of one of the labs to show you how it's set up. I'm going to stop my share for a moment. But if you do have any early questions, and I think I see one, Susan, I'll share with you to get us started, and we'll do a quick tour of one of our labs. Okay, so Susan, the first question I'm seeing in here is, where would these labs be best suited for an associate's degree or a bachelor's degree? Where do you see these best fitting?
And I think that they go across any, degree program. I have taught in all of them. I've taught associate, bachelor's, and second degree programs. And I design these labs to make sure that any student would feel comfortable doing them. Because when it comes to nursing skills, obviously, no matter what degree program they're in, they're all sort of coming from the same basic level of not knowing anything medical. So this really is not designed with any of those thoughts in mind, just that it's for nursing students in general.
Great, awesome. Okay, let me quickly share my screen here with you all, and we can just take a tour of one of our labs today. Make this a little bit larger before I start that off. Here we go. So excited to bring you into one of our labs. This is our vital signs blood pressure lab that we're going to do a walkthrough of today. Every single lab that we offer has three sections: an exploration, which is going to be the background content to set students up with that foundational knowledge they need to effectively perform the skills. That's going to be followed up by the experimentation section, where students actually perform those hands-on skills, followed by an evaluation, which is really a post-lab assessment of students' achievement of the learning objectives. We're always going to kick off the labs with an estimated completion time for our students to have a gauge of about how long they should expect to take while performing those skills, as well as the learning objectives for that lab. And then we kick into our formative assessment, which is a quick, what we call a knowledge check. These are foundational questions. What do I know before I enter into this lab and this experience? Typically, these are definition-based questions, true-false-based questions, really just assessing what do I remember from lecture, what do I remember from being on campus, from my prior experiences, and what do I need to focus on as I'm going through the exploration before I begin the experiment. As we're in here, students can go through, they're going to click through. These are all auto-graded, which is nice. I'm not going to make you watch all of them. They'll get instantaneous feedback if it's correct. If they get it incorrect, they'll get the correct answer for them to review. From there, students are going to enter into the content itself. As Susan mentioned, we have a mix of written content, case studies, images, animations, all go into the exploration content. And at the end of each page, students will encounter our question time questions, which are a quick check. Did you understand what you just read? Once again, these are going to be auto-graded for you. Students get that instant feedback. If they get it wrong, they'll get an explanation of what the correct answer would be. And the way this is set up is you can set this so students can complete it just once. You can set it so that students have multiple attempts at those questions if you so desire. I'll hop on down to this next page here. Once again, mix of hands-on. We're going to give this animation a second to load here. This one is a demonstration of what the carotid cuff sounds are, and what they would anticipate hearing while taking blood pressure. And then we move into the experimentation section. Once again, students are going to get a reminder of the estimated completion times, followed by the learning objectives for the experimentation section. They'll then be presented with all of the materials that they're going to need to perform that activity or experiment. That's going to include anything from student supply materials, things like pencils and papers, a volunteer in this case is needed, a piece of paper, hand soap, sanitizer, so they can go through the practice of washing their hands before beginning any activity. That's also going to include all of the materials that are included in the kit. So in this case, they're going to get the blood pressure cuff, stethoscope. As Susan alluded to, among the materials that students are going to get, there's a pulse oximeter, a blood glucometer, the arm, and an injection pad as well that are all going to be included in that kit for the students. And then we get into our exercise itself. For the exercise, students are always going to get a brief introduction to what they're working on, and that's going to be followed by step-by-step procedures. When we put these procedures together, we're very careful that each step is one action, one step, one action. Anything more, students do tend to get overwhelmed. We want to set up our students for success, so we try and keep them short and concise so that students have the opportunity to really focus on what they should be focusing on as they work through that activity. For the experiments, like Susan mentioned, we do supplement those with images. We supplement those with videos where applicable for students. So here they're learning how to take blood pressure measurements. And then at the bottom, they're able to record any data they collected, any observations they've made. So here they're going to include the systolic and the diastolic reading, then the blood pressure for the participants they're working with. And that's always going to be followed up as well by long answer questions discussing, what can you conclude about your volunteers' help, and really applying what they've learned in the experiment, what they've collected in the experiment, to their broader knowledge. Like I mentioned, each lab is capped with our evaluation section. This is going to be a short, typically 8 to 10 multiple choice questions that students have the opportunity to go through. They can answer those questions. Won't make you watch me answer all of these today. At the end of those multiple choice questions, they'll always have one long answer question called our extension question. This is taking what they've learned in the lab and applying this to a real life situation or scenario, so they have the opportunity to really dig in and apply the knowledge they've gained. From there, they can submit that assessment. They'll get a warning if they skip questions like I have today, and they'll have the opportunity to really view in detail, did they get it correct? Did they get it incorrect? And if they get it incorrect, what they need to go back to in the content to really review and refresh on that topic. For any kit that we offer, you can use all of the labs we have available. You can use a subset of those labs available. It's really up to what you're teaching in your course. But that's just a quick tour of how we set up a lab and what the course would look and feel like if you were using our Nursing Fundamentals kit. So with that, I'm going to switch back over to our presentation. We're happy to open things up one more time for questions today. So please add those to the chat or to the Q&A bar, and we can start going through those. Okay, Christine, I see one here for you. How do students get the supplies for the lab activities or their kits? So yes, these are kits that we manufacture. We provide all of the supplies that students are going to need, barring some exceptions, like I mentioned, hand soap, paper towels, the volunteer, of course. But what we do is based on the labs that you select and elect to use, whether you use all 22 nursing labs, maybe just 10, we'll build you customized kits. So you'll have the opportunity that they can be shipped to your campus. They can be shipped directly to your students. And that price is really going to depend on which selection of labs you ultimately elect to use. But you can go from anything from 22 labs to just a subset of those. Science Interactive will build the kits, ship them to your students for the coursework that they're doing. Okay, let's see, what other questions do we have in here? And please feel free to add more as you think of them. Can you talk? Okay, here's a great question, Susan. I'll let you kick things off and then I'll follow up a little bit here. Can you talk a little bit about safety of doing these experiments at home?
Yeah, sure. So, of course, there probably has to be some sort of thought to that. So if we're sending the lab draw kit, then we are going to be using needles or some sort of something that'll puncture. And so there, should be sort of a disclaimer that students should make sure that these are kept in a safe area or not, used for play or whatever. But for the most part, stethoscopes and blood pressure cuffs and glucometers don't have any, parts that would allow for any sort of injury. So, it's just with some, forethought that the instructors could say to the students, when we're buying these kits that you would want to sort of keep it safe. I've seen, in my 20 years of teaching, people go home with a fully catheter kit and 2 weeks later, when I ask them to bring it back to use on a model, it's been chewed on by the dog and I mean, all sorts of horrible things have happened to it. So sure, that would be something that I always encourage my students to do was just make sure that they kept that kid in a safe area where it wasn't going to be swallowed by the dog and or a child.
Oh my goodness, that the dogs and children are definitely probably the biggest questions we get with any home lab kit. And I know I think about that because I have both in my own home. So what we do supply, in addition to what Susan mentioned in sort of precaution and setting students up for success when they're using the kits, the other thing is that Science Interactive does provide very rigorous safety training in all of our with all of our kits. When you adopt a lab or a course with us, all of your students will be required to complete a lab safety lab and lab safety orientation as a part of that course. It's our longest lab, and I often say it's rightly our longest lab because it is the most important piece of doing a hands-on lab experience at home. That's going to cover everything, as Susan alluded to kit storage, what to do if you have kids or dogs in the home, how should you store it, how should you approach that, how to dispose of materials, how to clean up if you have a spill. So all of that is included within that safety lab. In addition to that, where there are applicable precautions, recommendations, we're going to include that directly in the lab context so that students are called out to any caution, that precautions that they should be taking. Where it makes sense, we've opted for models. So the arm models for the phlebotomy, the injection pad, we don't want anyone actually giving injections at home by any means. So that's why we've opted for those instead of using our volunteers for that. And then of course, we do cover liability on the kits. If anything should happen in the process of performing the labs, Science Interactive will take on that liability. We've never had to use that in our 30 years, but that is there as a reassurance as well. Last question I see here off the bat today is related to accessibility. Are your labs ADA compliant? Yes, they are. All of our labs are written to be WCAG 2.2, excuse me, compliant. They are screen reader compatible. So if you do have students who require accommodations, we can support those students in performing their labs. Okay. Oh, hi, Michaela. Thank you for your question. So um, what Michaela's question is, what do you use to build these lab activities or modules? Are they based off of certain publishers' textbooks or resources? How often are these reviewed for updates and accuracy? So I'm happy to take the updates and accuracy question. This is our initial launch of the nursing program. So these labs have just gone through a review process. We have a very rigorous review process for any kit that we offer. That's going to include bringing in subject matter experts like Susan. All of our labs are reviewed by a board of advisors external to our company in the process of creating them. Typically faculty members who are teaching that lab course online or that course online, in addition to our own internal review process. Once we've launched a kit, typically every 3 years or so, we are reviewing, going back through, updating those labs. So we do try to keep up and keep revising the content as we move forward down the line. Susan, I know you mentioned OpenStax as part of the basis for the modules that you built. Are there any other resources that you used?
No, OpenStax textbook. I just used it straight out of there, and that's that open education resource for higher education that is free. And I actually had the opportunity to write a couple chapters for that.
Awesome.
So it's very rigorous, it's peer reviewed. It's a very good content area. And they also have a process of updating and reviewing for accuracy. So I think that that's a great resource for students. That is a free resource that is really important for them to understand and know.
Awesome. Okay, two more questions here that I'll take, and then we'll wrap things up. First, how do students get the kit? Do they get them from bookstores or do they purchase them directly? We work with both modalities. So if you are a school that you can have the kits shipped to the bookstore directly and students can pick them up there. They can purchase a voucher code and redeem it through our website to purchase a kit from the bookstore. Students can also buy them direct with a credit card. So we work with most all options to try and make sure students have easy access to the kit as needed. Next question is an important one. This one comes up all the time, is how do you address student cheating? Obviously, very, very important topic. Within our content on our platform, you can set those labs up to be proctored. Time-based, students can't navigate away while they're working on them. That is an option to you that is available. In addition to that, we do rotation of the questions. We're building out question banks for this discipline, as well as we very closely monitor cheating websites, our Chegs, our Course Heroes, all of those lovely websites. We know students are great about sharing answers with one another. We do monitor those and actively pull down any of our content that does get out there. So we take a number of approaches to try and prevent that cheating. In addition, when it comes to showing that students have actually performed the skills within the labs, every lab that we author does require students to upload a photo at some point of them performing the lab. If it's not a picture of them directly performing the lab, if it's a stage of the setup, they will be required to include their name and the date within that picture. Some folks like to elaborate on that, have them include an ID as a part of that picture to show that it is actually them performing the techniques. So we try and manage and address cheating from a number of different levels, just because we do know it is prevalent out there, unfortunately, and try to work our best to manage and prevent that as much as we can. So thank you for that question. Okay, before we wrap things up, we are excited today to be giving away 5 free nursing sample kits to our attendees. So our winners today from our attendees are Kathy Alvarez, Emily Field, Karen Rousseau, Tracy McDonald, and Kellen Edmund Orsitel. You guys have all won a free nursing sample kit that will be shipped to you. Our team will be reaching out to get you set up to receive those. If you are interested in learning more about the nursing discipline, please use this QR code. This will bring you to our website with more information on nursing, as well as the other disciplines that we offer. We work with a number of different programs, not only to support nursing fundamentals now, but as well as some of the prerequisite labs, A&P, biology, GOB chemistry. So we do have a number of nursing related programs as well that can support your program. We thank you all so much for attending today. Thank you, Susan, for joining us and participating in this development. It's been wonderful to have the opportunity to work with you. And we look forward to sharing more information about the nursing kits with you down the line.
Thank you, Caitlin.